Resident doctors will be on strike from 7 a.m. on Friday the 14th of November until 7 a.m. on Wednesday the 19th of November. It also comes just ahead of a spike in flu cases, meaning the NHS is braced for significant pressure over the coming weeks. However, NHS services remain open to those who need them. The last round of strikes saw the NHS come together to keep the majority of services up and running, and staff will be striving to do this again. We're planning for 95% of elective activity to go ahead, so patients should continue to attend appointments as normal unless contacted by their hospital and told otherwise. You should continue to use 999 in an emergency and otherwise call 111 or use 111 online, as well as local pharmacies or your GP. We acknowledge there are some legitimate and long-standing non-pay issues for resident doctors, which the NHS is taking action on through our NHS England 10-point plan for improving the lives of resident doctors. Many members of staff working in the NHS would hope that this strike was not going ahead, and I hope that resident doctors will work with the government to settle this dispute so that progress on improving the NHS for staff and patients can be made. Meanwhile, I would like to thank resident doctors who have chosen not to strike and all staff in the NHS who I know who have gone the extra mile to keep our vital services going during this period. The NHS will prioritise patient safety and minimise industrial action's impact as much as possible, and we urge the BMA not to get in the way of those efforts. The most important thing is that our message remains the same as always. Do not put off seeking care and come forward for treatment.